Love and abundance, everybody, and a warm welcome to What's Your Story? I am the life orchestrator millionaire, Dr. Varun Gandhi. Today's guest is Dr. Suneel Dhand in What's the Deal with the Vaccine? What a year 2020 was. COVID changed our life drastically. Our behaviors have changed. Like instead of driving to work, now we walk to work. Instead of in person meetings and interviews, we meet on Zoom. Now, companies are embracing a more permanent work from home. And while all of this was going on, frontline workers rolled up their sleeves to safeguard our lives. And then the vaccines rolled in, Pfizer, Moderna, Johnson and Johnson, so many options what to do. And then most recently, the second wave caught India horribly. We're talking about so many questions for our guest today, Dr. Suneel Dhand. So who is Dr. Suneel Dhand? He is a board certified internal medicine physician. He was born in London and grew up in Berkshire, England. He went to medical school at Cardiff and then moved to the United States, completing his medical residency at Baltimore. He has since worked up and down the East Coast of the US in a number of different healthcare settings and environments, and currently practicing a mix of inpatient and outpatient medicine. Dr. Dunn's main clinical interest and passion is lifestyle and preventative medicine. He started a popular healthcare blog and YouTube channel called Medstoic Lifestyle Medicine and is the author of 3 well-being books. So Sunil, my first question to you is, man, look, you are a board certified physician, internal medicine physician. You have this really, really, really popular YouTube channel. You have it all, man. You're still single. I don't understand this. What's the story, brother? What's your story? Let's hear it.
Well, no, thank you, Varun, for that great introduction. I do appreciate it, and yeah, I'm involved in lots of different things. And as you said, I grew up in England, and growing up, I toyed with many different career options. I had a period where I wanted to be an airline pilot, growing up near Heathrow Airport. And then I wanted to be a vet for a little bit. Then I finally realized I was Indian and must become a doctor. So I grew up with those obviously immigrant values with parents who were very strong on education. So that was instilled in me very young that you must become a professional. And I'm glad actually, as much of a pain as that may have been growing up, that it was instilled in me. And then when I was around 16, 17, I got set on medical school, went to university in Cardiff, which is about 2 hours west of London. And medical school, I don't know where the years went by, really flew by. A lot of fun at the same time as studying. And then when I was in medical school, I became switched on to the idea of training in the US. So I did my qualifying exams in medical school. And then I graduated, worked for about a year in the NHS, and then moved over here, did my residency, as you said, in Baltimore, internal medicine, which is a very broad specialty to train in. And then when I started working in that, I worked mainly in the hospital and realized very quickly that a lot of the illnesses that I was seeing on an everyday basis were as a result of chronic illness, chronic comorbidities, chronic disease that were the result of lifestyle choices that we were making. And that got me turned on to the whole idea of lifestyle medicine and preventive medicine. And I've always been into playing sports growing up, which I know is quite an un-Indian thing, but actually my parents really encouraged me from a young age to get involved in sports. So I played many sports, cricket, football, tennis growing up, and got into more sort of working out on a daily basis at the gym, healthy eating. This was a couple of years after I finished residency training. And since then, that area of interest kind of exponentially went up for me. I wrote the well-being books, as you again mentioned, and then wanted to try to promote it more via my social media. And I currently practice a mix of both inpatient medicine, working in the hospital, as well as working in a lifestyle medicine clinic. So I have that balance going on. But I'm very passionate about this area, lifestyle medicine. It touches on so many things, even within the last year with COVID, that we haven't really been promoting as a society as much as we should. But then away from work, I'm a big believer in you work hard and you play hard as well. So you have to have balance in life. So pre-COVID, I was a world traveler. I used to try to visit a different country every year, involved in other activities outside of work, because I do believe in balance. That's so important to not only your one's physical health, but also mental health as well. So that's where I am now. And obviously, over the last year, everything has taken a dramatic turn, and none of us signed up for this. But we've been thrown into a pandemic and have had to adjust not only our work schedules, but also our personal lives as well. No traveling for me over the last year. Been
I
very
bet
bound.
I bet you're looking forward to traveling.
Oh, I cannot wait, Varun, for the world to start moving again, as many
Yeah.
people can't wait for.
Yeah, definitely. I definitely agree with that. So I know one of those questions is going to be vaccine passports, and we're going to talk about that in a little bit. Before we get to that, I really love your mission that you have stated on your YouTube channel. I want that you want to people to live your healthiest and happiest life possible. So, kind of like, what? How did you get onto that mission? What was the point that clicked for you?
Yeah, so I feel that health and wellness is so much more than just physical health. Of course, physical health is the fundamental building block of anyone's life. If you haven't got physical health, you can't do anything else. And that's very much what we're focused on as doctors. But we can't forget the mental health component of this as well. And if you were to ask any doctor honestly, who has been in medicine for any length of time, mental and physical health are linked together intrinsically. I can't tell you the number of times I've seen patients in the hospital and we'll take their history, whether they've had, say, a heart condition come up, an infection, and you probe more deeply, and they will say, yes, actually, I haven't been myself lately. I've been really stressed about something. I haven't been eating. I haven't been sleeping. And then, bing, that's when they get sick. That happens all the time. So, me as a lifestyle medicine doctor, I can't focus solely on physical health. The two are linked together. So obviously I'm not trained in mental health, but I want to have a big mental health component to what I do and what my mission is, because people need to feel well, both physically and mentally. And a big aspect of what I focus on, which is part of the name, is stoicism,
Hmm.
which I've come to know more within the last couple of years. It has made a dramatic impact in my life. And I feel like we live right now in the complete opposite of a stoic society. And many people have a false notion of what stoicism is and kind of think it means you're just very passive, you let things happen and just accept them. But that is not what stoicism is. Stoicism, if you go back to the original Stoics, they were very much people of action.
Right.
And it's about being able to take a step back, control your emotions more, and have a more measured approach to anything you do in life, but very much operate according to reason rather than emotion, which will keep getting you in a lot of trouble if you do
Hmm.
that.
Yes, definitely. Yeah, I love that the definition of stoicism, and I completely agree. A lot of people kind of get that wrong, and so I'm glad you. I was going to ask you that, but I'm glad you kind of went there already and talked about it. So recently, the vaccine came out.
Big
Uh,
news. I
yeah.
that has that really happened?
What there are a lot of doubts about it though. So what is the effectiveness of the vaccines? Who should take it, and what are your recommendations around that?
Yeah, that is a great question. I know a lot of people have many questions and concerns surrounding the vaccine. So let's go back to the beginning of the pandemic when it all first started. Within a few weeks, we were very much pinning our hopes on the fact that there would be a vaccine. And many people in the medical community raised the point that actually vaccines are often easier thought about in theory than in practicality, and especially for coronaviruses, this would be very difficult. So, come autumn time, September, October, there was news coming out that we were very close to a vaccine, and then in November, when news broke that Pfizer, which was the first company to release the news, had conducted a big study and found an effective vaccine, many people were very euphoric, and we were kind of pinning our hopes on this being the end of the pandemic. Now, the initial study, which I actually made a big video on, and you can see on my channel about the effectiveness of the vaccine, I went over the actual study, which not enough people, even I'm sad to say within healthcare, looked at. And yes, it was a reasonably big study, about 40,000 people, but when you look at the numbers who actually got COVID, the absolute numbers were relatively small, and there were not a lot of vulnerable groups in that. There were a lot more healthier people than in a typical group of people that are affected with COVID. So those were the concerns that I raised.
Mm.
However, the options are either we proceed through this pandemic with no vaccine, or we go with the fact it's 2021 and we have options available. And the study did show effectiveness in the group study. There's no doubt about that. And we wanted, especially over the last few months, to really focus on getting this vaccine to high risk groups, and which has been very much the focus of what I've been doing, uh, focusing first on the elderly, those with comorbidities, those with other risk factors. For instance, my parents were very, very keen as soon as they heard this news to be vaccinated. And of course, for an older person, you face that choice. Either you accept the fact that you may get COVID or you take the vaccine. And the simple issue is that it's far better to have the vaccine than it is to have COVID-19. So, absolutely, in anyone in a high risk group, you want to recommend the vaccine. As for side effects, fortunately, there are side effects, but they appear to be very small in numbers when you consider the overall amount of people. I mean, if this vaccine was having large side effects, we would have quickly seen it on the news if it was affecting hundreds of thousands of people. But clearly, nothing we do in medicine is without risk.
Hmm.
So, in answer to your question, the vaccine has shown effectiveness in the studies released so far. However, the data is somewhat limited. We're getting more data all the time. And the big questions for the medical community and for society at large are how long is that effectiveness how long is it going to last? And what's going to happen once people start moving again? Because the virus is out there now. And I make the point that even if you vaccinate 100% of people, that's not going to make the virus disappear. It's still going to be there. And viruses, like any life form, want to survive. And they're going to find ways to do that. The virus is mutating. The coronavirus vaccine is not like a vaccine for other diseases such as measles or mumps, which are very stable viruses. So my concern is that the vaccine will show some effectiveness, but as for people putting their hats on it as an end to the pandemic and COVID magically disappearing, that's unlikely to happen. I still would urge any vulnerable group out there after getting vaccinated to still take precautions.
Okay, so you definitely suggest still wearing the masks and social distancing and still taking those precautions even after the vaccines have been taken.
Well, we have to come out of this. I mean, nobody wants to wear masks and social distance
Right.
forever. And at some stage, it's going to be a risk trade-off for everybody, saying, okay, well, this risk is going to be there if I enter a big crowd, they have COVID and give it to me. And I've already seen in the last couple of months breakthrough cases. People have come into the hospital despite being vaccinated. But what we hope is those cases are much more mild. And I would say that somebody, especially with risk factors, after getting vaccinated, should still take sensible precautions. But I understand the need for society to reopen. It has to. We can't continue like this. And especially younger people need to live their lives. They need to go to college. They need to go to work and need to start traveling. In fact,
And they need to go for spring break.
that exactly. That's right.
So you kind of briefly mentioned, we kind of touched upon it, some of the voices that are not being heard. Can let's talk about that. Maybe they're being suppressed by media, or I'm not sure what really is going on and why those voices are not being in the mainstream. But some of the doctors that have experiences and they're sharing their voices, but they're not really being amplified. Could you talk about some of these cases that you've seen and the significance of them?
Sure. Oh, I would like to divide the action of the medical community into two parts over the last year. We've had the frontline doctors, other medical professions, nurses, who have been like absolute heroes, and it's impossible to have any qualms with them. We've been thrown into it, and we've gone above and beyond. And the second part of this is the medical establishment, which I do feel hasn't been anywhere near as good as they should as people of medicine and science in hearing out a broader range of views. And I know there are lots of doctors and scientists who have had concerns with many aspects of our COVID response, including the effectiveness of lockdowns,
Mm.
school closures, certain parts of mask mandates, like the need to wear masks outdoors, and also with the vaccine rollout, questions regarding, well, should we be vaccinating? And I know we're going to talk about this, people who have had COVID. Should we be vaccinating children? Are we moving too fast on this after dealing with high groups? And it may be that the answer to those questions are, okay, no, we have been doing the right thing. We've been being as cautious as possible. But my issue is that I don't feel that those questions have been heard out as much, and certainly not in the media. There's been this one-dimensional mentality which is actually the opposite of medicine and science. Sad, really, that we've come all this way. And when
Mm.
you read about the history of mankind, the history of medicine and science over the last 2,000 years, whether Galileo or other people who have come out with views which have been deemed to be somewhat away from the mainstream thought, i.e., groupthink, they have been they have been pushed back against and often silenced and intimidated. My hope is that in 2020 we would have moved away from that, but sadly I do see elements which are much more what I call absolutist and have a kind of my way or the highway kind of approach. This is what's going to happen, and you're not allowed to ask any questions. And again, I'm prepared to die on the science and medicine hill saying that that is completely the opposite of good medicine and science. People should be allowed to ask questions, they should be allowed to have hypotheses, and you should not be in an environment of intimidation or feeling like you're going to be silenced or threatened, especially if you're asking it in a perfectly reasonable way.
Yeah, can you talk about? I mean, completely agree with that. That they shouldn't be silenced, and science is all about asking questions and hypothesizing. So why not, have that in an open forum? Could you talk about you? You mentioned that case in Massachusetts. There was a doctor bringing something up, and he was silenced in a way. Could you talk about that case?
Oh, there have been many such incidents of that. There's one in particular. There's actually a Harvard professor, very specialized in epidemiology and virology, who has since the beginning of the pandemic been saying the same thing, that there is a better and more common sense way of doing things, and he has been harassed repeatedly online by other people in medicine and science, and he even has had Twitter and maybe even Facebook posts blocked and censored. And I really feel that this is wrong. And with the mask mandates, so many physicians in Massachusetts, when I think it was actually in October, a new mandate came out saying you have to wear masks outdoors even if you can't socially distance. So technically, if you were hiking alone, if there was no one around you, you had to wear a mask. And I feel that this is again going back to the reactivity issue of wanting to react to numbers and do anything, even if it doesn't make common sense. Lots of doctors disagreed with that and said it's sending the wrong message. COVID is overwhelmingly spread indoors, and we shouldn't be telling people to focus on outdoors. Okay, if you're in a big crowd, fair enough. But if you're outdoors just walking your dog and no one is around you, you don't need to wear masks. We can at least have common sense rules behind that. Despite the voice of many doctors uh, actually actually clearly saying that this was not following the science, it was still mandated, and it had been for several months. I think just until 2 weeks ago.
And then there was this whole case study in Sweden, right, where they talked about the closures not being effective.
Exactly. Well, Sweden was a bit of a pariah since the very beginning. The media really piled on them. And remember, under normal circumstances, Sweden is seen as a role model country by many, especially within the media. It has a very fair, equality-driven system, and a big governmental support for many people over there that is lacking in many other Western countries, and they have great outcomes for education and health. So they took this path from the beginning to say, okay, well, we're going to have a hands-off approach. We're going to encourage people to be sensible, to take their own precautions, but we're not going to mandate strict lockdowns. and attention was really focused on them. They may have had slightly higher COVID rates than their neighbors, but overall, compared to other European and many other world countries, which have had much stricter COVID policies, they've actually fared much better. And those are later statistics. They haven't been off the charts as bad as many other authorities thought they would be by adopting this approach.
Wow, that's interesting. And then Texas adopted that approach, right? And there was some good news out of Texas you were mentioning.
Yes, I mean, much of the southern US has fared better than many northeastern states. And I am a data driven person. I'm not going to get political, and I have no interest in driving any agenda, but just simply looking at the numbers. And from the beginning of the pandemic, the worst performing states in terms of death rates have been New York, New Jersey, and Massachusetts. And that has been consistent. You can go online and look at death rates. This is now 16 months into the pandemic. Those three states have been among the worst. And I think Rhode Island and Connecticut are not far off that. But yet I feel so much disproportionate attention has been focused on states like Florida, Texas, other southern states who have been much more, I wouldn't say lax, but they've adopted a much more sort of, a much more ease isn't even the right word, but a less strict approach to COVID restrictions, and have told people, certain groups, to be careful. They've been better with vaccine rollouts as well, and that is reflected in the numbers. So as far as numbers go, I don't think that anyone could argue that the states in the Northeast that have been strictest, and even California, this applies to as well, which I know is where you are, have fared worse than other states which haven't had these strict rules in place. And you cannot argue with the numbers.
You know what? California is still not completely open. I think the governor announced June 15th that they would completely open California, but we're still not there yet. So that's
Wow.
very interesting. Yeah.
Oh, yes.
And then you said Texas. You said Texas has they've reported zero deaths.
Yeah, I saw on the news today something about, for the first time, Texas had reported zero deaths. And remember, this is a state, along with, I think it may have been South Carolina or maybe Florida, which a couple of months ago announced that they were going to relax all restrictions. And they got so much heat for that. People were calling, I think actually the president called them Neanderthals. And now they've got better numbers. So again, I mean, this data is right in front of us. And you can make points about, okay, well, stopping spread in certain communities where there are very high rates of transmission, but you can't argue with the overall numbers for the states.
That's very true. You can't argue with the data. When you have numbers, you can't go against it.
Exactly. You're a science guy as well.
Yeah, yeah. Exactly. So the vaccine. If you had COVID-19, do you need the vaccine?
$64 million question. I made a long video about this, which I think is when you reached out to me. So I'm going to answer this question again in two parts. I'm going to talk about my own personal situation, and then where we are with data. So I actually had COVID in February of last year, 2020. I contracted it. And this was before we even knew that COVID was among us. But it was, thankfully for me, a mild infection. I thought it may have been the flu. I was better in a few days. And then afterwards, same happened with you. I'd like to hear your story.
December 2019.
Oh, wow. So you're
Yeah.
way before that. And you were in California.
I was in California. I was out for 2 days. It never ever happened to me before, but I was out for almost actually 3 days. I couldn't walk. I couldn't do anything. I was just completely drained, completely out, no energy.
Wow.
I wouldn't eat anything. I wasn't hungry. Yeah, no taste, no nothing. It was just, yeah, that's me.
Yeah, I didn't get the symptoms of loss of taste, but I do remember afterwards I had this lingering dry cough, and it would just come on at different stages of the day. And I thought, this is very strange. And then when we realized a couple of weeks later that, yes, COVID is everywhere, I thought, that must have been COVID. And I had an antibody test in May, which was positive. So I put two and two together, and yes, I'm 99.9% sure I had COVID. As part of my job, I have to regularly test my own antibodies, and I kept returning positive for antibodies. Then in March, I had a more specific, sensitive test. It was a complete blood test as opposed to a finger prick test, and it showed a reasonably high level of circulating antibodies. So on the basis of that, which is my current debate at the moment with medical and scientific community, is why would anyone with high levels of antibody right now need a COVID vaccine? And I'm not going to take it myself until I see compelling evidence that, okay, it's going to bring me some benefit. And it's not like the current vaccines were even tested on the variants. They were the original version that I got. And that's another reason why I'm not convinced that the vaccine will work against different variants more so than people who already had the infection. Now, again, nobody wants to have the infection. I just happen to have it and recovered, and I'm in this situation. And I'm still, as I said, as a doctor, recommending the vaccine, especially focusing on those high risk groups first. So that's where I am. As for whether you need it or not, if you look online, this is an area which is very, very gray among medical professionals and scientists. Interestingly, when I've talked to doctors, I would say hardly any doctor has told me that I need the vaccine. It's mainly people in science and random people listening who have heard my video and written down in comments that yes, you should get it for all sorts of reasons, including the fact it may give my immunity a quote unquote boost. Other people telling me to set an example, which I find strange to say. I mean, you don't do anything in medicine that's not indicated. You have to follow the actual science. I would say to anyone who's had COVID to consider getting an antibody test. It's an IgG test. And if you're still positive, you should really have a discussion with your doctor about the necessity of getting a vaccine right now, because many doctors will tell you that you could probably hold off. Now, if you want to get it for practical reasons, because you want to travel, that's another matter. I mean, right now it's not being compelled for travel purposes. And there may be situations where people want to be more careful. Say if you have certain medical conditions and you're just worried about catching COVID again. If you had a particularly severe case, I mean, for me, it was a more mild infection. So like everything else in medicine, it's not a one size fits all approach. You have to take each individual and have that discussion with your doctor. That's what I would urge people who've had COVID to do, to consider an antibody test, especially if they're on the fence or worried for any particular reason, and then kind of take it from there.
Okay. And well, we kind of talked about travel and the vaccine. What do you think about the vaccine passports?
Huge area, very controversial. So,
Yeah.
I personally am against vaccine passports, not because I'm against vaccines, but because I have serious concerns about whether they would be practical or even legal. Now, if we take reasons why they are very difficult to institute, I mean, the first is civil liberties issues. If you live in a Western country, no matter how passionate you feel about a vaccine, or even whatever side of the debate you're on here, you cannot get around the fact that we live in democracies where people have certain freedoms and choices. And if you're talking about restricting people from traveling and doing everyday things like going to a restaurant on the basis of them having a vaccine passport, that very obviously raises immediate concerns, which are probably unconstitutional. It's a different matter if you're doing it for school or colleges. Again, you can make the argument that it's so early in the pandemic you shouldn't even be doing that, but you can't escape that fact in this debate in a Western country that there's obvious issues with civil liberties. The second issue I feel, Varun, is that it may lure people into a false sense of security. As I've mentioned, I've already seen breakthrough cases of COVID in people who are vaccinated. And the reality is, as I said as well, that viruses mutate and you will get new strains. That's not possible to avoid. So would the vaccine passport lure people into that security when actually they could still get COVID? And the third reason is it may not fulfill the goals. This also links to the false sense of security. But if the goal of a vaccine passport is to stop the spread, then my argument is that actually doing a rapid test, and I don't know why anybody can't design a test like this. We're so far into the pandemic, but say a 10-second, really accurate, cheap test that would be super easy. It could be a saliva test, or you may breathe into it. But I don't understand why that hasn't been designed yet. And before you say enter a big crowd, you could quickly see whether you're positive for COVID or not. That would actually do far more if the goal is to stop the spread of COVID. That would be far better than a vaccine passport, in my opinion.
So what does the data say? How many cases have you seen in that second point of yours? How many cases have you seen where they have had COVID the second time after they got the vaccines, or they had COVID after they got the vaccines?
I've seen several in my hospitals. Now, fortunately, in mild cases, and that's the hope from doctors and scientists is that if you've been vaccinated and you get COVID, that it will be a much more mild case. But we had the recent situation last week. You probably saw on the news of the New York Yankee players who
Mm.
got COVID. And my understanding is some of them were asymptomatic, which gets to a whole different question is should you be testing people who have no symptoms for COVID who've been vaccinated? Many doctors, and I read this online, people were debating saying you shouldn't even be doing that in the first place. But if we're going to be testing people without any symptoms, we're going to get more and more of these cases because theoretically, Varun, there's no reason if you're vaccinated, say you walk through a room and there's a few COVID particles in the air, they're going to go straight into your nose and they may not give you any symptoms. But if somebody tested you right afterwards, you would be positive for COVID.
Oh, that's interesting. Um, and so vaccine passports, I completely agree with you that I, sorry, no for you?
Oh, thumbs down for me because they're
Thumbs
not
down. Same.
work and they're not a practical thing to do either.
Right. Yeah, definitely thumbs down. A lot of our viewers are Indian, and just recently something happened in India. What the heck happened in India? How
Yeah.
did it escalate so bad?
Well, yeah, boy, have things changed in the last few months. I actually made a video in February about why India's COVID numbers were so low. And there were all sorts of theories, including the fact that their population is thinner than in the West. They have more natural exposures. And they also, the way that they count cases over there, no doubt it's an undercount in India. But now, I mean, 3 months after I made that video, we're in a complete opposite situation. It's spiraled out of all control. So I have a few theories as to why this has happened. One is a complete relaxation of all restrictions. We saw election rallies. We saw those big festivals, religious festivals, which no doubt spread the virus, and then people went to different parts of the country and spread it to their own communities. A second reason is I believe that this second wave that we're seeing in India is affecting a very different group of people from the first wave. The first wave, which happened in March, April of 2020, ripped through the poorer classes. And there's no doubt that many of them suffered, many may have died, and we didn't know about it because nobody cares in India about the poor. And there's no infrastructure over there to count those cases. So that happened. But now the cases are ripping through the middle and upper classes, which is still hundreds of millions of people. And those people live very different lifestyles as well from the poorer classes. Many of them have adopted Western style eating habits. And there's no doubt that conditions like diabetes and obesity are underdiagnosed, which we know are huge risk factors for getting badly sick from COVID-19. So that is also playing a part. And then the third aspect of this is the fact that India has a very, very basic healthcare infrastructure. And I've seen this. My relatives, unfortunately, I mean, we're upper middle class. But when I've heard the stories over there of what goes on in hospitals and the fact that they often lack, these are decent hospitals, basic supplies, you have to buy them yourself and bring them to hospital. Sometimes there's no food to give patients in the hospital, relatives have to bring them in. It doesn't surprise me at all that if there were strains on a system like that, that it was going to get overwhelmed very, very quickly. And they have struggled with basic things like oxygen. A lot of people just need oxygen for a few days and they'll be okay. But in India, that hasn't happened. Combine those three things with the fact that India is a perfect breeding ground for variants to emerge because of the population density and the fact that the vaccine rollout, especially in those high risk groups, was very slow. That's why India is in the situation it is now. And I really hope things reverse quickly because it's been terrible over there for so many people.
And I think that strain, has come in now, and that's kind of creating havoc as well, and it's adding to the numbers. So that's, yeah, I completely agree. I hope hope the situation improves quicker in India. And what do you feel? I mean, from everything that you've seen, there's been a lot of support that's gone out from all of the Indians that live abroad. What else do you feel like we could do? Because there's so many resources out here, but I think we just have
Exactly.
to get it organized. So, in what way do you feel like can we help them out in India?
Well, I think the obvious way if you're overseas is to go through a charity, but you have to be very careful with India because sadly, you know, like we're of Indian descent, there's so much corruption over there, and you can easily send your money straight into someone's pocket that you don't want to do. So what I did personally, I went through a well-known charity. I did my own research. Certain charities have high ratings, like and are well-known, like the Red Cross, UNICEF, and you can be pretty confident that the money you put in there is going to go to the cause to which it's intended. I wouldn't go with any charity which has been recently set up in India. I've heard religious charities are sometimes better than others, like Sikh charities have good
Mm,
reputations. But I would advise anyone who's overseas wants to donate to India to really do their own research and go with a bigger, well known charity before they send their money over there.
okay.
And oxygen, very, very cheap to buy. I mean, if you could do a lot of good with even $100 in the West if you send it over there.
Definitely. I've been working with the Joy of Sharing Foundation, and we've been raising funds to send oxygen cylinders and, purchase it from China and send it over to India. And so we've been doing a lot of that. And our target was to reach about 5,000 cylinders
Wow,
over time.
great
Yeah.
thing to do. Well done.
Thank you. Yeah. So they've been doing a great job. Joy of Sharing Foundation has been doing a great job. So, okay, what is a post-vaccinated world going to look like? Once the numbers increase, a lot of people have gotten their vaccinations. What's going to change, or is anything going to change?
I hope we can get back to some semblance of normality. Now, I'm not a big fan, Varun, of the term new normal. I really don't like that term because I think that it makes people instantly pessimistic, that things won't go back to normal. You won't be able to travel and do all the things that you loved before. I'm actually more optimistic on this than many others. I think that the truth is humans have been going through pandemics for a long, long time. And most of them, in actuality, have been far worse than COVID-19. I mean, the Black Death, for instance, killed 50% of people infected, the plague. The Spanish flu killed millions of people 100 years ago, and the average age of death was only 28.
Mm,
What we have now is not as bad. As bad as it is, it's not as bad as that. And eventually, we will reach the point where I think we accept that we've done everything we can. We're vaccinated, we are taking sensible precautions, but we have to accept that there will always be some risk there. The path to a zero COVID world, as Boris Johnson, the Prime Minister of the UK, said, is almost zero. We're not going to get there now. The virus is here. We have to learn to live with it, and hopefully, it will eventually become like the flu, where we just accept it's there and we may get it. And I think there's no getting over the human spirit. If you
mm,
look at previous catastrophes which we've gone through, whether it's world wars, Great Depression, other bad things that have happened, humanity has a knack of coming back because people want to live life. People want to be happy and they want to fulfill their dreams. And I think whatever blips we're seeing right now, that will eventually overcome everything. And certain aspects of what we're doing may remain, like masks, for instance, say for an elderly person who's in a big crowd, that may
mm.
not be a bad thing to take sensible precautions. But I do think that this pandemic will wind down over time and people will resume their lives. We can't live like this. And the primary driving force, even from politicians, is that we all want that to return. We want to be able to travel. We want to be able to meet in big groups because we are social animals.
Definitely. And I was just thinking, you mentioned sports earlier. You're a huge sports fan. When do you feel like the sports arenas and everything's gonna, in the sports world is gonna go back to normal with maybe 100% occupancy?
Oh, I think it's happening. I think it's already happening. If you look at the UK, the FA Cup final, football final, soccer, they call it here.
Yeah.
It's yeah, they had a big crowd, and I'm very optimistic within the next few months, especially in the US where there's so many sports lovers. We're going to have that semblance of normality return, whether it's through people showing a vaccination card or quickly testing people before they go in. that will restart. I have no doubt. The
So,
one elephant in the room, though, Varun, I have to say, which is different now from any other pandemic, is our phones. Okay,
mm,
24/7 news can be a bad thing. And my concern is that even if we start seeing local spikes of COVID, when those alerts start, we may get into a similar pattern again. But even that, we will eventually learn to live with it, I feel. But let's not forget the impact of social media on this. And there's a big argument to be had that had this pandemic happened 15 years ago,
mm.
the action would have been completely different all over the world.
Yeah, that's very true. And then Clubhouse picked up, Zoom picked up, and then Clubhouse picked up, and all of these social apps that just came up in the last year or so.
Exactly. And I'm sure many people out there, I mean, aside from the obvious tragedy of the fact we're in a pandemic, many people have used this time to reflect, and they've changed many aspects of their own lives. Maybe working from home occasionally isn't such a bad thing. Humans are social animals. As I said, we want that interaction. So we'll go back to something, but there will be some learning points that will come out of this.
Definitely, definitely. Uh, Chelsea or Man City?
Neither. I'm leaving. How could you say that? No, if I
I
had
was hoping, I was hoping you'd say Chelsea.
if I had to choose, I would pick Chelsea because I'm a Londoner, but my team is Queens Park Rangers. Yeah, they
Oh,
are
QPR.
a smaller London team, QPR. A few years ago, we were good before money crept into the game to the degree it has. Now we're quite rubbish, actually, unfortunately, but I still support them. Chelsea are our neighbours.
Oh, okay, gotcha. So, is there a rivalry between QPR and Chelsea?
There used to be more when we were on the same level, but yeah, we are considered West London rivals.
Oh, okay, gotcha. So now the money has crept into Chelsea, but not into QPR yet.
We're still a small team, unfortunately.
Oh man. Well, that's actually really good that you're still supporting them. More power to you for still keeping up with them. At some point, like Leicester City fans got rewarded. What was it when they won the title a few years ago? They got rewarded for the true diehard fans. I'm sure QPR will be the same too.
Exactly. Yep, that's my hope.
So
One
sorry, go ahead.
one day.
One day, definitely. I'm going to ask you one last question.
Oh,
This is going to be about. So you were on the front lines, and you saw a lot of tragic, you saw a lot of death, you saw a lot of stories that have changed a lot of people's lives. But I want to leave with a happy memory. So can you share a happy memory from your kind of time on the front line?
yeah, I would say actually that there have been a fair number of happy memories. Firstly, the way that the medical frontline workers all came together, banded together, doctors and nurses, has been great. I'm immensely proud of the profession. And I think there have been so many stories of patients who have had successful recoveries. The
Mhm.
vast majority, even since the beginning of the pandemic, March, April, they would come in, we would give them some oxygen, and nearly all of them got better. And we've got a lot better at treating it now. But I've had a lot of 90-year-olds, many people approaching 100, who have done well. And we've managed to discharge them, and they've gone home with smiles on their face. And that has been a great feeling. Yeah, so we miss those stories. We see the bad numbers and the deaths. Obviously, that's extremely tragic and sad. But many patients have got through this, and they've had strong recoveries, and now they're at home living life.
Wow, that's amazing. So moving forward, what would be one advice that you could give everyone to live a healthy life?
I would say always remember that nothing comes before your physical and mental health. Make that a priority, no matter where you are in your life. I know a lot of people are busy with careers, with young families. Never forget that. And my golden piece of advice is have 1 hour every day completely blocked out for physical activity, whatever it is. Ideally, it's something strenuous, but it could even be going for a long walk. You can even throw 10 minutes of meditation out there, but have that strictly blocked out. Listen to music, listen to your favorite podcast, but do not check emails, do not send any texts. Have that time for yourself and making your body strong. Obviously, the rest of the time you want to be eating healthy and everything, but I think that piece of advice, no matter where you are in your life, be really strict about that. Have that hour completely to yourself will reap you a lot of benefit.
I love that advice. I kind of do that something similar, not on a daily basis, but I do go on these long walks where I just put in a podcast. I put in something on YouTube, like a positive affirmation on a video on YouTube, and just listen to that and go ham for an hour. So I love that advice. It's really good, and I always feel rejuvenated. I completely shut off my phone and just listen to the affirmation. So
Yeah.
thank you, Sunil. It was a sorry.
I said enormous benefits. If you do that, it's not just about the hour. It's everything you get afterwards as well. You get the boost in energy. You become more productive, focused. You sleep better if you can do that. So I'm glad to hear about your relaxing walks.
Yeah, thank you. Thank you so much. Sunil, it's been a pleasure chatting with you. We've learned a lot from your experiences, from your, everything that you've gone through in the last year or so. Thank you so much for sharing everything. You've been really great. The audience has loved you. I hope you have a fantastic day and love and abundance, everybody.
Thank you. Good to be with you.
All right.